you're 55 and you have horrific knee arthritis and you can't play with your kids, you can't play golf with your buddies anymore, you're otherwise healthy, but you can't do anything, why are you waiting 10 years to some arbitrary 65 when who knows what your health's going to be at that point? You've lost a decade of activity of your life. There is a quality of life intervention urgency, and we want to get you back to doing the things you want to do as soon as possible. The reason you're having this surgery is to return to living, have a lifelong joint replacement. Hi, I'm Dr. David Crawford, a board-certified fellowship-trained hip and knee surgeon here at JS Orthopedics in Columbus, Ohio. In my former life, I was in the military for 9 years, serving our men and women in armed services, and left the service in 2016, came on and did an adult reconstruction fellowship at JS Orthopedics, and been practicing here since. So we're located in New Albany, Ohio, which is just on the outskirts of Columbus, and formerly known as Joint Implant Surgeons. We're the oldest orthopedic practice in Columbus, and our founding partner, Dr. Tom Mallory, performed the first hip and knee replacement actually in the Midwest over 40 years ago. We're very proud of our heritage, and we've been the pioneers in especially outpatient and rapid recovery joint replacement. And our partnered surgical center, Whitehead Surgical Suite, has now performed over 10,000 outpatient joint replacements. All the surgeons at JS Orthopedics are board certified, meaning that we have the American Board of Orthopedic Surgeons who has conducted both written and oral examinations, as well as ongoing maintenance and certification. We are all fellowship trained, meaning that we underwent special training to do the surgeries we do, whether that be spine surgery, joint replacement, sports medicine surgery. And we are honored to have our two senior partners, Dr. Barron and Dr. Lombardi, be members of both the Hip Society and Knee Society. These are two separate societies that honor the top 100 hip and knee surgeons in the entire world. I'd say what separates us most from other surgery centers and orthopedic practices is our experience and innovation. We are all very high volume surgeons, meaning we do a lot of joint replacements, a lot of shoulder replacements, a lot of spine surgery, and that's important in creating efficiency and creating great outcomes. We have an amazing staff up there, from nurses to administrative staff and scrub techs who are there during surgery giving us instruments. And with that, we've brought on some other technologies. One of those is robotics. New tools are aimed, especially in knee replacement and hip replacement, to put the implants in a more perfect alignment to what we determine for each individual patient. So we all know that price of healthcare in the United States is exorbitant, and price transparency is something that we're all driving to get a better handle on. And certainly our federal government has acted recently in that and mandating hospitals to have price transparency. So you as a patient looking around, you have to understand what all goes into the cost and the pricing that is offered out there. We at JS Orthopedics are understanding of this, and that's why we have partnered with Medical Tourism Corporation to offer services that you may not otherwise have access to in your local geographic region. And while we all want the lowest price for the best quality, it's hard to determine what that means. And I guarantee you can shop around on the internet and find some price lower than what we are currently offering. However, what you don't have visibility of necessarily is the quality that comes with that price or the hidden costs. So what we have developed is a very clear and transparent pricing. There's no hidden fees, there's no extras that get added on. But we understand that traveling for medical care certainly brings a lot of apprehensions and concerns, and our goal is to ease that as much as possible. We provide a concierge service for all of our patients, both locally, but even more so those coming in from out of town. We've had patients come from Dubai and other Middle East countries. We've had patients come from Arizona, Washington State. So we're very familiar with taking care of patients both locally and from around the world. And to aid you in your journey, what we will do every step along the way is make sure that all your questions are answered, your concerns are addressed, and that you have all the information possible for you to not worry about the little things, like where to park and where you're going for prescriptions. So typically the process will start that if you want to consult with JS Orthopedics, you'll submit your request through Medical Tourism Corporation. They'll pass the information on to us. One of our surgeons will reach out to you and have a phone consultation. Typically, we'd like to have some x-rays that they've been taken available for us to review. We'll take a look at that, speak with you on the phone, talk about what you've done. And honestly, we may say surgery is not the best option for you, even if someone else has told you that. We're here to do the right thing for you, not just to do surgery. So if we determine that you are a good surgical candidate, we'll work with you to set up the travel arrangements. Typically, you'll fly in or drive in if you're coming from out of town a few days before surgery. You'll meet the surgeon the day before surgery. Along with that, our amazing pre-admission testing internal medicine doctors who will listen to your heart, lungs, follow up with your labs, make sure you're as tuned up as possible. Then surgery will be performed typically the following day. You'll be able to go home to the, when I say home, honestly, it's not to your home, but to a hotel, or we also have a medical facility nearby that offers some medical beds. And you'll typically stay in town for 2 to 3 days, just depending how you're doing and what surgery you have. You'll follow up with us in the office a few days after. We'll check on the incision, get some x-rays, make sure you're doing all right, and then also provide physical therapy every day while you're here in town. And then after you leave town, we'll follow up via video conferencing or phone calls. We'll have you get some x-rays from your local primary care doctors if those are needed, and follow up from there on an annual basis.